My name is Tyler Smith. I'm a staff physical therapist. I was looking into a lab tech position. A person very close to me said, no, you wouldn't like that. It's in a lab. You like people too much, so look into physical therapy. Once I got in the profession, I realized it was a perfect fit. I'll get my schedule, figure out who I'm seeing, and then we just start the day treating patients. And so 80% of the day is spent doing patient care in the geriatric skilled nursing environment. The other 20% of your day is spent trying to justify to an insurance agent why is it reimbursable. So everything has to be documented. We're seeing patients that have been in the hospital for an injury or surgery, and they've come to our facility to get back to the level that would allow them to go back to their home, getting in and out of bed by themselves, walking appropriately, using an assistive device if that's necessary. And at times we recognize that some of these patients won't be able to get back to that prior level of function. So then it's our job to try and plan the safest discharge. Probably the most common injury that we see is a patient that may have fallen and fractured their femur bone. On top of this, the patient's got heart disease, various forms of dementia. You need to be an expert in understanding the injury, but also understanding those comorbidities. Knowing the anatomy, knowing the physiology, and knowing the pathology is really the highest skill points. The secondary part of that is then knowing how to handle that patient safely, provide the least amount of pain or discomfort during your assisting them from lying down to sitting, assisting them from sitting to standing, and then assisting them with walking. You must have an undergraduate degree, preferably a Bachelor of Science. And then once you've got your bachelor's degree, then you apply to go to their physical therapy program, and then it's another 3 years at the physical therapy school. Grades are crucial because that's the first cut that any school with applications is going to look at, specifically in math, science, and physics and chemistry. Most programs will insist that you observe a therapist. It's a good opportunity for you to learn about what you like and to see if it's actually the field for you. There's so many different avenues as a therapist. You can work in hospitals, you can work in skilled nursing facilities or outpatient clinics, pediatric needs or children's needs, or more of the younger sports medicine injured athletes. There's always going to be demand for physical therapists. You usually have several job offers even before you graduate. It's a very hands-on field. You have to do the studies, you have to have the knowledge base, but you have to also be good with your hands and your ability to interact with people.